what are some tips for coping with that physical aspect of losing one's license, and and as well as kind of coping with the emotional aspects of it?
There's certainly a pretty good body of research now that shows that older adults, driving cessation almost doubles the risk of increased depressive symptoms. So one of the things that, and again, it's really important to start having these conversations early in the process. The person needs to give themselves time to get over the loss. They also have to try to stay involved in their regular activities if at all possible. So if they can no longer be behind the wheel, hopefully there's family members or neighbors or friends that are available for providing a ride, or the individual, they can become familiar with other forms of transportation, such as buses, light rail transit, volunteer driver programs. One of the populations that it's very difficult for is dementia. So if you have a dementia, you will not be able to use on your own buses or LRT, and that's where a ride-sharing service such as Uber or volunteer driver programs can fill in that gap. There's also a really urgent need for therapeutic approaches that can help older adults who've had to stop driving adjust to life without driving. One of the most impactful research areas that I did was on driving cessation. And we had developed support groups for driving cessation, and we had individuals with dementia and their family caregivers, and we had a clinical psychologist hosting the patient with dementia group, and then we had a social worker host the caregiver group. And it was just absolutely heartbreaking, but really insightful to hear and understand how difficult it was for individuals, especially for males, to do that transition from the driver's seat to the passenger seat. It was like they saw it as an indicator of being incompetent, and for many of them they said, I just have no reason to live. And thankfully, the psychologist, the clinical psychologist that led the group, it was really interesting looking at the transition from the sadness and the anger at the start of the groups, that towards the end of the groups, they started appreciating, and they weren't happy that they weren't driving, but at least they felt a little bit better about themselves. And the caregiver group, again, the social worker, really important to have support for that part of the population, because they go through almost as much as what their family member goes through. It's a very, very, very difficult area, and hopefully the recognition, some of the legislation, the policies we have in place, our family physicians that understand and have the conversations with their patients, and then the opportunity to be in a support group with other individuals really makes a significant impact in terms of how they feel about themselves and about how their journey on driving cessation will go forward.